welcome one and all to the very first National Patient Data Day.
At Use My Data, we're organising the first national patient-led conference here in Leeds so that patients get a say about how their data is used.
I think it's amazing to have a conference that is focused from the public and the patient perspective. You know, kind of this is their data. We should be thinking about it from what matters most to them.
It's about working with other organisations who are using health data research, but also promoting what's the patient benefits of that and how can you involve patient and public in using their data.
The thing that excites me most about this day is the opportunity to listen really and hear what the members and the attendees are saying about their data at the moment.
I think there are great stories to be told, great positive stories to be told about using this extraordinary goldmine of health data that we have in the UK. And people who are doing that work need to be bolder, far bolder, about telling the positive story.
I came to the National Patient Day to talk about some of my work in applying artificial intelligence in ophthalmology and the central importance of patient data in that work. So I'm very, very excited to be here.
I'm very much here today as an advocate of patients sharing their data. It's been collected already. Let's fully utilise it.
And it's just glorious to get sort of excitement. That's from the positivity of people really wanting their data to be used for good causes.
The reason we've held a National Patient Day today, the very first Patient Day today in the country, is because we wanted to start the conversations between patients and researchers, between patients, people who hold our data, between patients and the people who make policies, all in one place to start a big conversation, or better still, lots of little ones.
That's a great question, because I think I'm going to be a patient someday, and what I hope that they will be taking away is how we use their data, how we can be trusted, and importantly, how they can ask us questions about what we do and whether what we're doing is what they want.
It's kind of being in the room with the policymakers and having that influential voice.
I'm hoping that the patients that are here today will take away some assurance that, you know, as an NHS, we're really looking after their data.
I think one of the things that I'm hoping that patients will take away from today is that the UK can be a world leader in AI-enabled healthcare. And to do that, we just have to really stop stepping on our own toes. We need to make better use of NHS data.
I hope people come away feeling confident that the patient voice, their views really matter, that they are being listened to, and what their involvement and engagement really will change things. And I'm very keen and enthusiastic that people do get more involved in how their data is used.
Some of the insights that we've found today that have really struck me is really the positiveness that data should be used.
I've already talked to 5 patients today and got interesting insights on how we can communicate what we do as a company and how best to be transparent to patients.
It's very easy to kind of have groupthink in this space. It kind of, you talk to the same people all the time, you end up just kind of coming up with a solution that feels perfect, but it's designed for that small group of people. By having different conversations and everybody bringing their own personal perspective, it can really kind of push and challenge kind of the way in which you think about the thing that you might have decided on, but actually realise maybe we need to go back a couple of steps.
Primarily, it was designed by patients, relatives and carers to think about aspects of usage of patient data, brought together academics, policymakers, commercial organisations, NHS and others with patients in the same room to discuss what patients expect to happen with data, to bridge the barriers people sometimes find about being able to have a conversation between two different groups.
I think it was a success. The turnout was great. Everyone stayed till the end. There was lots of amazing discussions that took place. There were people who were interested in joining Use My Data. And for me, I felt there was a big sense of collaboration, regardless of if it were professionals, patients, people in industry, everyone kind of came together.
The winner takes it all. It was a brilliant day. Everyone seemed to enjoy it.
couldn't ask for more than that.
I thought it was a really great day today. Lots of energy in the room. So good to see some of the progress being made against some of the challenges that we historically faced. There's definitely a feeling that we could be going faster to use more data to achieve more things.
All of the exhibitors in there, people who hold our data, people who want to use our data, NHS bodies, have all been grilled in a positive and open, transparent fashion by patients about what it is they're doing, what they want to do, and above all, how we can help them do it faster and do it more accurately.
Having patients pull that together, patients design the entire programme, has been really innovative, groundbreaking. I've not seen this done before, and I really think it's the start of something significant.
So the fact that Use My Data has been able to put on this day, hear from so many people, hear about actually what are the obstacles that people need to overcome, so that we can actually get better healthcare in the UK, I think is just absolutely fantastic.